everyone, this is Jasmin Ramones, your student nurse, and for today's video, I'll be showing you how to check blood pressure manually. Good afternoon, ma'am. I am Jasmin Ramones, your student nurse for today. Ma'am, may I ask what your name is?
Juliana Ramones.
Okay, how about your birthday, ma'am?
November 11, 2007.
Great. How would you like me to call you today?
Juliana is fine.
Okay, Juliana. Is it okay with you if I will going to take your blood pressure?
Yes, nurse.
So, how are you feeling right now? Do you have any pain?
I'm good. What is the procedure?
Okay, Juliana, I will going to take your blood pressure. I will going to check it. This will serve as baseline data and it will help identifying any underlying heart conditions that need immediate care. Is it okay with you?
Yes, nurse.
Okay, thank you for that. That will entail me taking this cuff, inflating it around your arm, feeling and listening to your pulse. It might be a little bit uncomfortable, but it should not be hurt. Is it okay for me to go ahead, Juliana?
Yes, nurse.
Okay, let's go. Juliana, I want you to sit properly. Your arm should be at the heart level, and then your legs should be uncrossed. Thank you for that. Then, what we're going to do is get our stethoscope, which is here. And what I will going to do is palpate the brachial artery because this is the artery that I'll be listening to get the blood pressure. In order to get the systolic number, which is the top number, the first sound that I will going to hear, and then the diastolic number, which is the bottom number, and this is the point where I no longer hear the sound. Attach the cuff to our patient's arm. I want to make sure that I find the brachial artery because this is the artery that we are going to palpate. This is the one that I will be using to determine the blood pressure. And it's found in the bend of the arm, so I'm going to go find it. And it is located here. The cuff has these arrows, and because this is the left arm, I should make sure that this arrow is pointing in the direction of where that artery is. So I will put the cuff 2 inches above the bend of the arm. First, I will estimate the systolic pressure, so I want to find that number. I will palpate the brachial artery and I will inflate the cuff until I no longer feel the brachial artery. I need to make sure that I'm looking at this gauge. Denote that number because that number is our estimated systolic pressure number. Then when I go take the blood pressure, I'm going to inflate the cuff by 30 millimeters of mercury more than the estimated number. The reason for doing that is that I want to avoid missing the auscultatory gap, also known as the silent gap, that can occur in some patients, usually those with hypertension. So I'm inflating the cuff, feeling on the artery, and I'm going to point where I no longer feel the artery. Which is about on the 130 millimeters of mercury. So my estimated systolic number is 130. Now I'm going to inflate the cuff to add 30 millimeters to it, and that will avoid missing the auscultatory gap if one is present. So I'm going to take my stethoscope and put it in my ears. Make sure it's on by twisting it and tapping on it. Right now, it's not making a noise in my ear, but when I twist it, I can hear it. That's how you know if your stethoscope is on and working. And then I will use the diaphragm of my stethoscope. we're done with our reading, make sure to fully deflate the cuff full of air, and I will take the cuff of my patient and clean the cuff. Okay, Juliana, we are now done. So your blood pressure is 100/70, which is a normal blood pressure. Thank you so much for your cooperation. To complete the procedure, I will go to check the blood pressure in the patient's other arm. Then I would record the results in the patient's notes and arrange for any necessary follow-up.